Well, hi, everybody, and welcome to a special GZERO live stream Beyond the Pandemic, a radical new approach to health security. I'm Meg Terrell. The event today is brought to you in partnership with Flagship Pioneering, the bio-platform company that founded Moderna and dozens of other life sciences firms. GZERO would also like to thank two additional sponsors, Partnership for a Healthier America and Medtronic. Now, in this program, we're asking a big question about what public health will look like after the COVID-19 pandemic. Could the biggest health crisis of our lifetimes actually lead to a healthier world? We'll be talking with world leaders, top scientists, journalists, and industry leaders about the wake-up call we've experienced over the past year and what it means for the future. Now, my co-hosts today are Ian Bremmer, president of Eurasia Group and GZERO Media, and Noubar Afeyan, CEO and founder of Flagship Pioneering. Welcome to you both. Noubar, let's start with the purpose of what we're doing here today. What conversation are you hoping to start globally?
Well, Meg, thanks. As you know, we at Flagship start all of our explorations, scientific explorations, by asking questions that start with what if. And during the next 2 days, we want to ask, what if we took our health security as seriously as we take our physical security? What if we spent as much time and resource preventing, preempting, and delaying disease as much as we do treating it, often when it's too late? We're hoping to get answers to some of these questions and to talk about what the agenda should be going forward based on our learnings from this devastating pandemic over the last 15 months. We think that pandemics don't just stop with infectious disease. We really need to think of this more broadly as to the whole health system, and whether pandemics such as Alzheimer's, such as cardiovascular disease, obesity, would those be better served if we start thinking not about just a sick care system, but rather a health security system. We're thinking about topics like, can we preempt pandemics? What would preemptive health and medicine look like, as opposed to the way we do it today, where we wait for diseases to exist and then spend tremendous resources trying to treat them? These are all questions that the crisis we've endured have given us the time to really reflect on. We also have a lot of learnings. We learned that things that were seemingly hard to imagine and not possible suddenly have appeared to be possible. For example, in the case of the Moderna vaccine and the mRNA vaccines in general, we went within 2 days of getting a sequence to having a product design. Within 40 days, we were in human trials, and within 9 months, we had an emergency use authorization. What does that tell us about what's in the future for vaccines? What does that tell us about whether we should accept vaccines that only barely work? Can we do more? These are all things that could take the positive out of the experience and really now take it to the whole world. Is it enough to be able to have vaccines available only in certain countries? What can we do better in that regard? So all of this combined, we really think is going to do justice to this notion of never again, but with technology, with policy, and with collaborations between governments and private sector, really working towards a very new state of affairs, again, focusing on earlier than disease and security.
Thanks, Noubar. And Ian, we're going to be talking about pandemic responses and lessons learned. Noubar just touched on one of the elements of inequities we've seen throughout this pandemic, which was experienced globally, but not equally. What did it reveal for you in that regard?
It revealed to me that in this, the worst crisis of our collective lifetimes, there has been absolutely no global leadership or coordinated response. A crisis of this magnitude we should be taking advantage of to create the opportunity to better respond in the future. And there's no question Noubar has been a hero in his ability to do that. And many in the private sector have, some in the public sector who we're speaking to over the next couple of days. But globally, that's absolutely not the case. And this is the right time to talk about it, because for the last year plus in the United States, my own country, coronavirus has been the single dominant topic of every day, of pretty much every headline. That is about to be not true anymore. So the window for us in the most powerful economy in the world to talk about lessons before we've decided that coronavirus is no longer our problem, that's a problem for other parts of the world, when it's really a global challenge, it's right now. It's fantastic that we have these vaccines, that the Americans, that the Europeans, that the wealthier parts of the world are rolling out faster than anyone had any right to have expected even 6, 12 months ago. But the fact of the matter is, not only is this disease going to persist in the middle and lower income economies for at least another year or potentially much longer, but also that the lessons that we have learned so far globally are vastly inadequate to prepare for coming pandemic challenges and coming health challenges. And I really hope that the work we're all doing together over today and tomorrow will make a difference in that regard.
I feel that. I feel that the headline nature of this thing we've all experienced over the last year and a half is changing, at least here in the United States. And you illustrated that so beautifully with that window of opportunity to make people here care. So before we talk about what needs to happen after the pandemic, we of course need to talk about the many parts of the world that are still very much in the throes of this crisis. I want to bring in now two of the world's top global health experts. Laurie Garrett is a Pulitzer Prize-winning science journalist, and Paul Farmer is the founder of Partners in Health, a global organization bringing healthcare to vulnerable populations. Laurie, let's start with you. You were early in warning about this pandemic here in the United States, and in November, you were asked how bad things were here in the US, and your response was, quote, "The gates of Hades have opened." Where would you say things stand with the pandemic now?
Well, on a global scale, we're still in Hades. We still have no strategic plan, no agreed strategic goal. As Ian said, no clear leadership. In fact, an absence, a paucity of leadership with some key nations showing what I would describe as negative leadership, meaning leaders that are actually worsening the crisis inside their own countries. I could single out India, certainly Brazil, and a number of other countries. And we have a paucity of any real semblance of equity, so that within countries, the poor are less likely to have access to anything that can both prevent and treat the epidemic in their bodies or in their communities. And as you extend that out globally, you see the same thing with less than 2% of the sub-Saharan African population exposed to vaccines, even a single dose, while we're approaching or aiming for a 70% coverage by the 4th of July in the United States. So we see basically everything that we've ever seen with any epidemic ever. It's been a pattern. And if this pattern flows the way every past pandemic and epidemic has flowed, the sort of post-mortem, once things calm down, will reflect an initial bout of chest beating and let's all reform and make it better next time. And all of that will be thoroughly forgotten within less than a year, and we'll go right back to the status quo of lack of full and equitable preparedness globally.
Oh boy, you always speak the truth, but it is scary to hear it. Paul, Laurie was just talking about the vaccine inequities we're seeing, and the fact that here in the United States, we are approaching 70% of adults potentially vaccinated, at least with one dose by July 4th. We're starting trials in kids down to age 5. Pfizer announced today it's moving into phase 2-3. As you look globally, where in the world do you see the greatest need for vaccines right now for COVID?
Well, I would just pick up where Laurie left off and say, I would point to the continent of Africa first, because that's where the lowest rates of vaccination are now. But also, as Laurie said, this has historically been the case. And so a lot of our attentions will be focused there. But, right off, I'm in Florida, and, not far from here is Haiti. And, Haiti has had really no vaccination yet. And there's the willingness and capacity, I believe, to roll that out. Now, it's not as strong in many countries as in Rwanda, where I just was last week, where there's a health system, which of course is having a proper health system, as Laurie pointed out years ago, is the best way to prepare for the coming plague. Now, they've done that there over the last 15 years. And that's why they see such remarkable returns on their investments in healthcare and healthcare delivery, not just prevention, because we have to remember when people are sick or injured, they do, to use Noubar's term, need a sick care system. They've got one. Sierra Leone, for example, where I was last month, does not. So that building of the system itself, able to anticipate, prevent, and when prevention fails, which it always does for some, respond with care, is the important thing to focus on. because it will too be lost in the shuffle if we don't keep going back to this question of how do we have effective systems to detect, prevent, but also to assuage the pain of whatever the epidemic in question may be, or pandemic.
Well, one of the things that Lori mentioned was that this pandemic played out the same way epidemics always have. I wonder what you experienced, Paul, in terms of inequality in health globally through this pandemic. Was there anything that surprised you about it, or did it essentially go the same bad way we could have expected it would based on history?
Well, you know, I won't say that I was surprised by any of the developments, certainly disheartened, unless I would, you know, return to the miraculous development of an entirely new kind of vaccine, and with massive implications for other preventives, but also for diagnostics and therapeutics. So that, for me, has been the big and welcome shock of the pandemic, is that we could respond so quickly on that front. I've never seen that. I don't think anybody else has either.
And Lori, just to wrap up this part of the conversation, although we'll ask you both to stay with us, you know, early on, it was clear that wealth wasn't necessarily an indication that a nation was going to have an effective pandemic response. So what surprised you the most about that pattern?
Well, in fact, just the opposite. The richer the country, the more likely you had a catastrophic response to this pandemic. And in fact, I would just bounce off something that Paul said. This search for viable health systems is obviously underscoring everything, but let's also not fool ourselves. Having a health system is not in and of itself a panacea. Canada is struggling mightily. The UK with a national health system is still struggling mightily. Most of Western Europe with national free healthcare is struggling terribly with this pandemic. Why? And I think we need to understand that we've really downplayed the significance and importance in our investment patterns and in our government structures of public health, population health, and gone the direction of individualized medical help. And so medical assistance is great if you're sick and you need to be hospitalized, but the whole point of a pandemic is to have you not get sick in the first place, not need to be hospitalized, frankly, not need a doctor. If all is going well, the health system is separately quiet, not at great risk, not doomed to try and deal with knee-deep demand of healthcare because we have implemented the tools of public health. So what has surprised me the most, to a point of tremendous distress, I must say, is how many governments, and especially my own, have absolutely devastated their own public health capacity and response and treated public health advocates as enemies. So that right now we have a call to actually kill Tony Fauci, jail him, make him lose his job because he dared to say, wear a mask. We are in a world where leaders don't want anything to impinge on economic advancement, and they actually are deluded enough to believe that you can have economic advancement in the middle of a pandemic and ignore the pandemic. And this is a dichotomy that I did not expect to see expressed to the degree and severity that it has been. And it's really distressing and upsetting for me, and I think for the whole world right now.
All right, Lori and Paul, please stick around with us. We are excited to get to come back to you in a bit for more. First, this crisis, of course, has been an enormous test for leaders all around the world in both the public and private sectors. We're honored to be joined now by one of the people who faced this test head on, Greece's Prime Minister Kyriakos Mitsotakis. First, Mr. Prime Minister, back in April of 2020, there was a New York Times article that said that Greece was defying the odds and had managed to avoid the devastating scenarios playing out in Italy, Spain, and later in the UK. To what do you attribute that early success with the pandemic and then perhaps the surge as we saw later for Greece?
Well, it was not rocket science. We listened to the scientists. We took decisions early. We shut down the country probably earlier than most other European countries. And one of the reasons I had to take that decision was the fact that although we had a national health system, it was underfunded after 10 years of crisis. So I knew our capacity in terms of dealing with a pandemic surge was relatively limited. When we took over, we essentially had 600 ICU beds for the entire country for a population of 10 million. We knew that was not enough, so we needed time. Essentially, we completely avoided the first wave. We were obviously not able to avoid the second and the third wave, but overall, Greece, a country which was battered by the financial crisis, has done better than most EU countries, certainly better than richer countries with better organized healthcare systems. And of course, we also used that time window to strengthen the basic infrastructure of the system. So we added ICU beds. We're now close to 1,500 ICU beds through a very aggressive investment plan. We hired people. So essentially, we were able to overcome chronic shortcomings of a national health system to make sure that we address the immediate emergency. Of course, now, as you pointed out, the real challenge is how do you build a healthcare system for the next century. Our healthcare system essentially is 4 decades old. We saw its limitations, but we also saw tremendous determination and commitment by our healthcare professionals. So in that sense, on certain fronts, we exceeded expectations. On others, it was very clear to me that there is a lot of work to be done going forward. So I think I will very much take the point that Ian mentioned. At some point, I do agree with him. The pandemic is going to be over, at least for the richer countries. And I think there is a general tendency to forget things that have been extremely painful. It is our obligation to make sure that we use the lessons of the pandemic to strengthen both our healthcare system, but also our public health policies. And that is certainly a task that my government takes very seriously. We have significant additional funding provided now by the European Union through the Recovery and Resilience Fund. But I think we also have the political commitment necessary to drive through change that sometimes is politically, delicate or difficult. Frankly, having faced what we had to face, the horrible loss of life, for me, there is no excuse whatsoever not to invest smartly. It's not just about money. Invest smartly in our healthcare system. Use the best available technology, and make sure that whenever there's going to be a next pandemic, we will be better prepared.
So let's talk about reopening. Of course, the pandemic was a blow economically for a nation that depends so deeply on tourism, roughly 20% of your economy. Your tourism minister declared in May that Greece is opening up to the world again. So how do you plan to do that safely?
Well, first of all, our plan is to open up safely. We will not compromise the safety of tourists. We will not compromise the safety of the local population. But we have additional tools at our disposal, which we didn't have last year. Let me just give you an example. Last year, we received 25% of the annual number of visitors to Greece. And of course, it was very, very painful economically. This year, we are able to use what was a Greek proposal, which was adopted by Europe, the digital COVID certificate, as a tool to facilitate at least intra-European travel. So we need proof of vaccination or proof of illness or proof of a negative test. And we did manage to get the European Union to agree, which is not easy, as you know, in 2 months to develop this tool, which is incredibly valuable to us because it makes our lives much easier. So we have additional tools. Even last year, we employed a very sort of clever artificial intelligence algorithm that helped us with our testing capacity in order to be more targeted in terms of our testing. And of course, this year, we also have an additional tool, which we found in Greece. Again, I'm always eager to share experiences and to listen to what other heads of state and government have to tell us. But we used self-tests very aggressively over the past 2 months. So we distribute them for free to almost everyone. Everyone who's employed has to have 1 or 2 tests a week. We opened our schools using self-tests. We found lots of asymptomatic positives through our self-test, which we later confirmed. So I think one of the reasons why we've done very well over the past couple of months in bringing our numbers down also has to do with the fact that we have a much better understanding regarding the patterns of the pandemic. So we intend to open up safely. There's a lot of interest. People want to travel. That's the one thing we know. When we ask people, what's the first thing you want to do after the pandemic? They tell us, I want to take a trip. And so we want them to come to Greece, but we want them to be safe. We have all our healthcare protocols in place. We still do a lot of additional testing. And we've also done something which I think is interesting. We've accelerated vaccinations on our islands. So we said, let's put our islands as number one priority, especially our smaller islands are practically fully vaccinated. So that gives also people the comfort that they come to a place which is relatively safe. And I do expect numbers to go down further as we increase vaccination. As you know, EU is probably 2 to 3 months behind the US in terms of vaccination pace, but we in Greece today are vaccinating 100,000 people per day. That's 1% of our population every single day. So every week makes a difference. Every month makes a huge difference. So we're catching up very quickly. And come July, August, September, the months where we really expect most of our tourists, I think we will be in an even better shape.
You mentioned the proof of vaccination or a negative test. That has been a real hot button issue here in the United States. What is the kind of cultural acceptance of that over there, in political acceptance? Has there been pushback, or are we a little different here in the United States?
Well, there's a big there's a big debate as to whether vaccinated people, it's starting now in Greece, should have special rights or special privileges. And how do we treat the vaccination skeptics from a political point of view, but also from a legal point of view? We're not there yet, because in order to have this discussion, you need to give access to the entire population in terms of vaccines. And we're currently still, we're probably going to be opening up all age groups, including the 18 to 25 within the next weeks. Once we give everyone the right to get vaccinated, we can start talking about facilitating those who are vaccinated, but it is essentially already happening. When we ask people to take, for example, self-test before they travel, or we ask for a proof of vaccination, if you're vaccinated, you do it once, you're done. Otherwise, it's going to be constantly very sort of complicated for people to prove that they are negative. But I think the real challenge is not going to be during the summer, because in Greece, everyone is outdoors during the summer. It is, by definition, much safer, and the summer is a better period than the winter. Come winter, I think when we will start moving indoors, that's going to be an interesting question. And I think there's going to be also, it's a question which is also going to be addressed by the market. I'm sure there will be many restaurants who tell us, and we will give them the right to do so, that we only accept vaccinated clients. People will realize suddenly that if they're not vaccinated, especially our youth, that they don't have the same level, the same freedom as their other vaccinated people in the same age group. And of course, the challenge is with those who are in the older age brackets. I was looking at the data now. We have approximately 360 people now in ICU beds. All with the exception of 5 were non-vaccinated. So it is very, very clear what is happening, and those are people who had the chance to be vaccinated and didn't choose to do so. So it's not just a question of social responsibility. People who are older need to get vaccinated because they can die. They can get sick and they can die. So, and I think we're trying to make that argument in the most convincing manner. But at some point, there is going to be a distinction between those who have been vaccinated and those who are not. And if it's not going to be a regulatory distinction, I'm pretty sure the private sector is going to adapt to that reality.
So you mentioned that Greece, or that the EU is a few months behind the US and the UK in terms of the pace of the vaccine rollout. And you've been critical of the EU's pace. Why do you think it has lagged behind the US and the UK to this extent?
Well, I'm sure, Noubar also has, experience in the negotiations that took place between the EU and the big, and the pharmaceutical companies. Yes, it's a pity that we're behind the pace. Having said that, representing a medium-sized European country, I am happy that the EU decided to purchase vaccines collectively and distribute them pro rata. I don't want to be competing with Germany, France, or Italy in a vaccine race. So I think this was an important political decision taken by the EU, and the fact that we're also thinking now regarding booster shots and purchasing vaccines for 22, 23, and again distribute them pro rata is an important demonstration of European solidarity. So yes, there were problems in terms of delays. the EU is not always the fastest supranational institution, but we need to coordinate policies amongst 27 member states. But the decision in itself was a very important decision, and I certainly welcome it as the head of government from a medium-sized European country. And I think and I think there are also two other aspects, two other policy areas where the EU has done well. For example, the digital certificate. Normally, in order to get a regulation approved, which is essentially legally binding, Europe, Ian knows that needs 2 years on average to get a regulation approved. We did it in 3 months, so there was a sense of urgency. And of course, the fact that we have mobilized significant resources at the EU level through the Recovery and Resilience Fund is tremendous. I mean, we essentially did what nobody thought could happen. We borrowed at the European level. I wrote a letter in March 2020 with 8 other heads of state and government to the President of the Council, asking him at the time to consider such an instrument. It was inconceivable at the time that this would happen, and it did happen. So it is an important step towards European integration. My country, Greece, will receive 32 billion euros, 19 billion in direct grants for investments and reforms. We've submitted a good plan that focuses a lot on digital transformation and the green transition. But this is really significant. It gives us a lot of comfort that it can also leverage private capital to really change the country in terms of driving through meaningful investments, including in healthcare and in digital health. I mean, the one thing which a lot of people were surprised with was how quickly we drove through the digital transformation in Greece during COVID. Our vaccination campaign was fully digital, and it was a big success. And people are pleasantly surprised by the ability of the Greek state to deliver on such a complicated process. So digital health and the digital transformation is a huge opportunity for a country such as Greece. We can actually leapfrog maybe other countries if we do it cleverly. And now we also have the funds to do so.
Well, you mentioned Noubar, so let's bring back in Noubar Afeyan and Ian Bremmer here. Noubar, I mean, what can you tell us from the perspective of being the chairman of Moderna and being on the industry side of seeing these negotiations play out? From your perch, what did all of this look like through the beginning of the pandemic and as these vaccines, these miraculous products were developed at such speed?
Well, it was really quite a learning experience for us all because, the pandemic kind of brought everyone kind of to some extent to the same level of relative ignorance about what's going to happen next. And there was a lot of experimentation, both at the level of the products and the approaches to treat and prevent, but as well on how governments would deal with the private sector, because at the time decisions were being made, there really was no way of knowing whether vaccines would get developed, how quickly, and which ones. And so I think what happened is, as usual, people take the experiences from the last time and apply it to the next time. Laurie mentioned that even that didn't happen in many ways. Well, in this case, I think people were to some extent trying to extrapolate that more conventional vaccines would have a better prospect and that it would take a lot longer than it really did. As I was listening to this discussion, I was thinking it took a tiny virus to actually make many of us realize that inconceivable things were actually conceivable and accomplished. And that's at the level of leadership. That's at the level of public-private partnerships. I can say in this country last year, I think much was written about the Operation Warp Speed and the effect that it had. I can tell you when it came to vaccine development in that time frame and the coordination, it really was a stellar success. I don't think there's any version of what happened in the 12 months in the US that could have happened without that level of coordination. Many people were skeptical, but actually industry, government cooperated beautifully. And so I think there's a lot of things to learn. We're going to sort out going forward whether we can afford to wait till it's a complete disaster before we start making these decisions. And I really hope that some of the learnings has to do with reconceiving health as not simply one that is important when people get sick. This is something that I really want to emphasize. Part of the reason we were caught off guard is that there really was not only public health, but there was no tools, nobody really cared about these things. And we cannot go back there because in 1 year we have suffered more economic damage than the previous 20 years from health-related issues and maybe longer. We can't wait for that to happen again.
Well, another question I have for the Prime Minister, and then I'll bring in Ian, who may have a question himself. We're talking about leadership now and pandemic preparedness. And of course, the G7 leaders are convening in the UK later this week. Mr. Prime Minister, what do you hope to hear from them about pandemic cooperation as they get together?
Well, there's only, again, that much, smaller countries can do in terms of global cooperation. And certainly we will be looking for leadership by the big players. And I think the observation that there was very little coordination at the beginning is correct. I very well remember during the first phase of the pandemic, this scramble to get access to personal protective equipment. I mean, it was just like the Wild West. I mean, everyone was in there for themselves. And I guess now that I think there are important, questions. I mean, we've all purchased more vaccines than we needed just to be on the safe side. So what do we do with the excess vaccines? When do we actually start distributing them? When do we feel safe to make a commitment to the rest of the world to help them? Because we know we're not going to be completely safe until we have dealt with this disease everywhere. Because again, I'm not a doctor, but I guess the big fear is, variants, mutations, what could happen somewhere which would, make us start again from scratch. Do we or don't we vaccinate kids? Are these vaccines better used? Are these vaccines more more valuable if you look at, global health, if they were, given to Africa? So these are important topics where we would certainly will be looking for global leadership at the level of the G7. Again, at the European level, I think we've played our part after some, initial delays. I think we've done a good job in terms of, allocating vaccines amongst member states and planning for the future. But these are some of the topics that certainly be very interested in being addressed at the level of the G7.
Ian, I want to bring you in. Any thoughts you have or questions you had?
Absolutely. I mean, we've been talking a lot about lessons learned, lessons not learned. I mean, after 9/11 in the United States, there's no question that if you wanted to bring a box cutter onto a plane, that wasn't going to be possible. But there weren't many broader lessons learned by the United States. And what impresses me so much about what Kyriakos just had to say is that the Greeks learned a broader lesson. They were a basket case during the Eurozone crisis, that his country has gone through a Great Depression that has been deeper and broader than the Great Depression experienced in the United States. And his people knew, and he knew as prime minister, that when this pandemic hit, there was no margin for error. So they actually learned the lesson from a completely different crisis that they had to respond immediately with expertise, with science, and without politics to effectively combat this crisis with a healthcare system that no way could handle the kind of hit that the Americans in principle should be able to handle, while we in the United States were soft. I hear what he's saying, that you've got folks that aren't going to be able to go to restaurants in Greece if they're not vaccinated. In Texas, not only is that not going to happen, they're passing legislation that'll make it illegal for a restaurant to do that. So what I'm interested in is whether or not, and by the way, Kyriakos, it's wonderful to see you here. I'm wondering if you think, you've been positive about the European response. Do you think that at the European level, in Brussels and the European capitals, do you think that they are starting to learn some of the lessons that you have been able to successfully display in Greece, deeper and more structural? A couple thoughts on that would be interesting.
Well, thank you, and also for your kind words. Again, the Greek experience is sort of unique because we went through so much over the past decade. But I think it's probably an interesting positive story that we did come out stronger. Our democracy, I think, is stronger now. It's not sort of written on the wall that economic crisis inevitably lead to more authoritarian responses. It did not happen in Greece, but I think there was certainly a moment where Europe, especially Northern Europe, and in particular Germany, realized that mistakes were made during the economic crisis of the last decade, and that they simply cannot be repeated. So that we really need to take the risk to spend more. The ECB got that immediately, and at the level of fiscal policy, we were willing to essentially say, look, we cannot let countries such as Greece incur additional debt. Let's take the debt on at the European level, and let's give these countries the ability to spend money, invest money, but do it wisely in order to make sure that they overcome the crisis, but they also drive the important changes that are at the core of the European agenda. And I think the real challenge now is to make sure that we make good use of the money that is available. That, I think, will also determine at the European level whether this is a one-off instrument or whether this is something which could be repeated in the future. So we have to prove, not just to Europe, but also to Greek citizens, that the money that was actually raised at the European level during the pandemic is used wisely, especially when it comes to the green transition, where we have a very bold agenda. We've decided to shut down all our coal-fired electricity plants by 2023, which is very bold given how dependent we were on brown coal, lignite. But of course, we need funding to fund the transition and to make sure it happens in a just manner. So I think what is at stake here is also the ability, not just of Europe, but of member states to become, at the national level, more competitive, to stick to our targets. We want to be the first continent to be climate neutral in 2050. But of course, this is only going to happen at the national level. And we have a big discussion ahead of us. We're waiting for the recommendations of the Commission, how we're going to achieve that goal. And of course, we need additional funding to do it, and we need to make sure we do it in a way that does not shatter social cohesion. So some of these challenges, I think, have been well understood. And I can tell you at the level of the Council, because we spent hours, days and days, thinking through the unthinkable. I think we've all realized that, these black swan events are really not that unpredictable after all. A lot of people were talking about this, but no one was listening. So we cannot afford not to be better prepared, be it, strategic issues of strategic autonomy, investing in, as you said, not just in our healthcare, but also in our public health. I mean, we know, the one thing I always ask my, our ICU doctors, so who are the ones who really get sick? And, there was a clear correlation between obesity and, really having a higher likelihood getting really sick. So it's not just about, the pandemic. It's about the long-term diseases that have to do with our lifestyle. Maybe, Greece has something to teach the world in terms of moderation, the Mediterranean, the Greek diet, and having a healthy lifestyle. Certainly this is a big part of our theme as we try to grow out of this crisis.
Well, I know when I've been in Greece, I just eat a lot of your cheese. It is wonderful. So I'm not sure I've learned the lessons of moderation. But Mr.
Goat cheese is healthy, and goat is better. Goat is, if you want to eat meat, prefer goat to beef. It's certainly much more. It certainly has a much lower environmental footprint.
I will take that into consideration. Thank you so much. This was a wonderful conversation. We very much appreciate you being with us.
Thank you very much.
That was the Prime Minister, Kyriakos Mitsotakis of Greece. And Noubar and Ian, we'll see you again later in the program. Now we're going to talk about health security. This past year, of course, has shown us the disastrous consequences that can come when global health security is undermined. So are there lessons that we can apply from national security that can help improve public health? Professor Lord Ara Darzi is the chairman of Flagship Pioneering Health Security Initiative, and Jay Johnson is the former U.S. Secretary of Homeland Security. We're joined again by science journalist Laurie Garrett. Welcome to you all. Lord Darzi, let's start with the term health security. Can you define that for us?
Sorry. Thank you and good morning to you, Meg. I'm sorry I was mute, the classical mistake. So what's health security about? It's about protecting the world from external threats, particularly from pathogens, as we witnessed in the last 14 months or so, the pandemic of COVID-19, but also from other novel viruses. And if you look at the last 20 years, it's not the first epidemic that we've had in terms of pathogens. We've had SARS, we've had MERS, we've had Zika, we've had Ebola, even H1N1. So as we expect governments to defend our physical security from certain threats, we should also expect them to defend our health from the threats that I've just described. So what does that mean? That means having the right surveillance, having the threat detection, rapid reaction forces all in place and ready to go. And that is what was missing during the COVID-19 pandemic. In terms of what we're doing at Flagship in this, have the privilege, as you said, chairing the Health Security Initiative. And I think we see health security as one aspect, by the way, of what we describe as preemptive medicine. That's because real security comes from acting preemptively to stop a threat before it arrives to our shores. And that mindset is critical if we are to get this right.
Well, as you just described that, I mean, Lori, I can imagine what you'll say to this, but how would you describe the state of health security in the US prior to this pandemic?
Well, Meg, first of all, I think the concept of health security is defined quite differently depending where you sit and how you look at it. If you're in sub-Saharan Africa, the notion of health security is very different from, say, being in Tokyo. In fact, the very term was originally defined by the Japanese, and it has nothing to do with the sort of security that we speak of when we link security to national security. So we have to be very careful about the semantics here. As far as the United States goes, going all the way back to George W. Bush, and in fact, to Bill Clinton's presidency, there's been a sense that there needed to be health and scientific expertise on the National Security Council, and that part of threat assessment had to include assessment of naturally arising or bioterrorism originating microbial threats to human health in the United States. Each administration has made its own special definitions and actions, preemptive structures set in place in the executive branch to address these concerns. Probably the boldest came out of the Obama administration with the creation of an actual health security network internationally that aimed to take the expertise of the United States CDC to train counterparts all over the world in self-reliance, in the ability to detect and respond to outbreaks with their own toolkits and their own expertise and their own personnel. But that's been grossly undermined because that agency that was supposed to be the guiding light, our Centers for Disease Control, has performed terribly in our epidemic and been greatly undermined by the Trump administration, and is only now beginning to recover, both as an internal institution and as a global scientific leader. And as far as health security goes, looking forward down the road, I think the fact that there is now talk of passing a treaty, a sort of health security global treaty, and that there has been a motion entered into the World Health Assembly to indeed, pursue that avenue, will mean that the whole world will have to talk about that phrase, health security, and understand and listen to one another about how that phrase resonates differently if you're in Lusaka versus Lima, if you're in Los Angeles versus, Tierra del Fuego. And we have to really understand where the shortcomings are and how to fix the giant gaping potholes of global public health. We're not there. We're not even close. And as far as the American capacity goes, we've had a real wake-up call about our hubris, our arrogance, and hopefully we'll be able to come on the other side of this crisis with a greater awareness of the failures in our system, the giant gaping holes in our system, and our inability to recognize the need to fund public health.
Well, Secretary Johnson, let's talk about the analogy to national security. What role does your former department play in public health?
Good question, and thanks for having me. As I sit here, it occurs to me, over the last 15 months, I've probably given well in excess of 100 public interviews on the topic of COVID. I think this is the first time that I've talked about this publicly where here, at least in the United States, it is mostly in the rear view mirror, and we can begin to assess lessons learned from all of this. The concept of health security is an interesting one. Most Americans are unacquainted with the concept. We think public health, we think national security, we think counterterrorism, but the concept of health security is a new one for most Americans. It is something that is probably new for the Department of Homeland Security. It is on par, however, with physical security. It is on par with public safety because it can be life and death. At DHS, we have an Office of Health Policy, which for DHS took the lead during the Ebola crisis in 2014, which I remember well because I lived through as secretary. But in assessing lessons learned, I do believe that it is important to elevate health security, the possibility for another nationwide, worldwide lethal virus as a real threat to our well-being. And so I'm fascinated by the concept of a treaty on health security. And let's not forget, with all the talk about a January 6th commission that failed to pass the Senate, that there's been talk about a COVID commission here in the United States, mandated by Congress with subpoena power, paid staff, distinguished Americans to understand what we failed to do, what we can do better as a health security, national security imperative. And there are real lessons to be learned free of the politics here. Some are obvious, some are less obvious.
I wonder your thoughts. You mentioned the treaty idea, and their increased international cooperation obviously is a huge piece of this, but there's also an element that folks like Dr. Scott Gottlieb have been putting forward recently in the context of this very heated conversation about the origins of the virus. He asserts that the intelligence community needs to be involved with public health pandemic sort of surveillance. What is your thought about that and the implications of all of that?
I think that is a perfectly appropriate idea. Annually in national security, we go through a prioritization of where the intelligence community should be focusing its resources. And this is a matter of prioritization and reprioritization. For example, while I was in office, I urged that we spend more time studying Central America and the origins of immigration to our southern border, which very often we have blind spots for. We have these spikes that show up on our southern border almost unannounced sometimes. And so there needs to be a reassessment of how we can apply our intelligence community resources to the origins of another lethal virus, so we can understand the contours of it, the sources of it, how it's transmitted, and the like. The fact that now, after over 600,000 Americans dead, we're still having a debate about the origin of this virus in China is really striking to me. We don't yet know what the exact origins of this thing that touched literally every corner of America.
Well, Lori, I want to bring you in here to talk about why we are in this position of being just so unprepared after we had experiences like Ebola, which the secretary was just mentioning in his previous answer. Why were we still so unprepared for this one? And I'm also very curious to know your thoughts on this origins debate.
Well, Meg, first of all, I think a lot of the lack of preparedness is because the infrastructure of health security that we were pushing in the world, we as Americans and our allies from Western Europe were pushing, was one that imagined that the threat would come from over there, those countries, and then affect us. And that our goal was to keep it at those countries and address it over there. What it's essentially a kind of post-colonial mentality that imagines that most of the world is poor, incapable, unskilled, and that we are superior and our scientific expertise will conquer every problem. And then we ended up having the worst epidemic in the entire world when COVID struck. And so we had we had a construct and a mentality about health security that frankly was a disservice to us when we actually faced this grave challenge. And then, of course, where do we go from there? We go to blaming the country that experienced the first initial shock of this epidemic in China, in Wuhan, and claiming that it was either deliberately made in a laboratory or made as a result of an experiment gone awry that escaped from the laboratory. But one way or another, it becomes yet another part of a much larger fight between the United States and China that encompasses every single aspect of economic and military competition, which we hope does not go to confrontation. And it came at a time when that competition was as raw as it has ever been amid a tariffs war and trade war that was escalating between the United States and China. It couldn't have been worse timing in terms of any hope that there would be a collaboration between the two nations to try and conquer the problem of the emergence of COVID and identify its source. As far as the source goes, I agree with the WHO Independent Commission that the likelihood that it is a laboratory leak incident is a very low probability potential, and that far higher probability is that, like all prior epidemics that we have dealt with, it's a naturally arising problem exacerbated by human behavior and human activities that allowed the virus to spread both within countries and then internationally. And unfortunately, finding its original medial host, that animal or species that was a reservoir for the virus from the bat that it originated in to the human being, at this point, I think will be almost impossible, because all mammalian species express ACE2 receptors, which are the receptors this virus latches onto in order to infect cells. And so we now are finding this virus in just about every mammalian species we look at. And in some cases, the mammalian species is getting it from our species, such as zoo animals. So I think we are at a point now where the fight over what are the origins has become a political construct and is no longer a scientific one.
Yeah, well, Lord Darzi, we'll ask you about where we go from here. How do nations approach health security, and what sort of political reforms are necessary or policy steps are necessary in order to be better prepared from a health security standpoint?
Thank you, Meg. I mean, there's a lot to learn, but I suspect the organizing principle is to get the right response first. That's the critical message. Even now, by the way, some governments, which I'm not going to name, think that the lessons of COVID-19 will be to have a bigger stockpile of personal protection equipment or to set up a domestic vaccine manufacturing facility. I believe these lessons are their own lessons. I think we need to invest in capabilities to monitor threats and really harness all the advances. Just take one example, machine learning as an example, to try and predict what the new viruses might be, what the new variants might be. We've also seen an amazing destructive development of messenger RNA. Who would have thought back in 2019 that it's actually the mRNA vaccines would be the way out of the pandemic? And I think, you know, much more comprehensive health security from anything, not just COVID, by the way. We're talking about mRNA vaccines for seasonal flu and potentially even the next zoonotic spillover. We can try and predict these and get ready and prepare for them. And I think to make all of this happen, there has to be some financing of this health security if you're really going to take it seriously. And you just need to go back from the last 14 months. You know, the world was spending $1 trillion a month on COVID-19. You know, if we just used a fraction of that to be ready and prepared in the future. Not only that, but also, our populations were overexposed and had too many comorbidities. The Prime Minister Kyriakis made a very good point linking the two, biological aging, but more importantly, the comorbidities of obesity, diabetes. We've seen a dramatic increase in the mortality in those groups, subgroups of the population. So, besides that, that is what we call preemptive approach, try to get ahead of disease and to keep people healthier and less vulnerable in the future. So these are the messages. These are, if you like, the pillars in which we can build such thing as a future secure health security systems across the globe. And it can't be at one nation. This is a global effort.
Lord Darcy, you give us the perfect segue into our next segment. So please stick around with us. And while we thank Lori Garrett and Secretary Jay Johnson very much for being with us, thank you both. And now we're going to bring back Paul Farmer, founder of Partners in Health, and also introduce Nancy Roman, CEO of Partnership for a Healthier America. Nancy, let's pick up on what we were just talking about with Lord Darcy and previously with the Prime Minister. That one of these clear lessons of COVID is that people and populations with comorbidity factors like diabetes, obesity, and heart disease did far worse overall. Can you explain your notion of fast pandemics and slow pandemics?
Sure. Well, thank you, Meg. I've really enjoyed the conversation. And well, I first heard the concept fast pandemic and slow pandemic from Dari Mozaffarian of Tufts. And I have to say, I love that way of thinking about it because it just makes so clear what's happening, right? The fast pandemic is COVID. It's killed millions. And I don't need to talk a lot about it because we're so familiar with it. The World Bank estimates it'll push between 119 million and 124 million into poverty. And that means food and nutrition insecurity. But the pandemic that gets a lot less attention is the slow pandemic. And that is the pandemic that Lord Darcy was just talking about. Obesity, diabetes, heart disease, even cancer, other associated diseases that come with obesity. And, it's a well-known fact to those of us in the field, but it's not a well-known fact to the public that in the 1980s, about 13% of global population was obese. That skyrocketed to 34% in 2008. And, today we have 1 in 3 people are obese, 1 in 5 children are obese. So obviously, if we don't get our act together, it's going to continue. A statistic that I found really just seared this onto my brain was in February when we got the revised data on life expectancy in the United States. And several of you probably remember it dropped by a year, which was big news in a developed world country like the US for life expectancy to be falling. It was COVID, but notably it fell 0.8% for Caucasians, and it fell nearly 3% for communities of color. And that disparity, which we rightly find intolerable in COVID, we have been tolerating in the slow pandemic of obesity, diabetes, and heart disease, where that disparity has been there all along. So I guess the last thing I would say is we've got to really look at what drives this. Some things are controllable. These are diet-related diseases, and food is at the very root of them. There are many other factors that come to play, all the social determinants. But there are many things that we know what to do, and we need to start doing it. I mean, it's really unacceptable to tolerate the two-tier food system that we've tolerated.
So we're going to have some audience participation now. We're going to give you a pop quiz out there. So those of you watching on GZERO's site will see a chat window to the right of the video screen on a desktop or below the player on a mobile device. Sign in there to cast your vote on this question. According to the World Health Organization, what percentage of global deaths each year are caused by non-communicable diseases? 15%, 50%, or 70%. So we'll give you some time to vote and we'll come back to that answer and see who got it right in a few minutes. And let's bring it over to Paul. In the meantime, obviously this discussion is really surrounding the idea that establishing better health overall is so important before you get to something catastrophic like what we've experienced. You spend your time working on this all of the time. Do you see an opportunity through this pandemic to be able to make more positive change? I mean, what more can be done to achieve better health as a foundation before we encounter the next one of these?
Well, I mean, not to be pathologically optimistic, but I sure do see that that possibility. And if we didn't see it, we'd have to create it and seize it. You know, just to go back to my own country, Meg, which I think I share with you, you know, this is a chance to roll out a series of long overdue investments in public health. And that includes the capacities that were already mentioned by Lord Darcy and others. It also includes a national health insurance program or a national health care backbone system. I work in a big Harvard hospital. It's not public, it's a private hospital, the Brigham and Women's Hospital. And we labored too. We didn't do a great job clinically if we look at case fatality rates in the early month of COVID. And a lot of that has to do with, as Nancy said, what goes on outside the hospital. One of the things that strikes me in this comparison that I elevated earlier between Rwanda, and I mentioned Rwanda and Sierra Leone because I've spent the years since the Ebola outbreak that began in 2013. I've spent much of that time in Sierra Leone. But the real contrast for me is Rwanda in the United States. How could a country, one of the 30 or 40 poorest countries in the world, Rwanda, have done such a much better job in one case preventing Ebola's cross-border migration from its western flank when there have been outbreaks in the DRC, but also in responding to COVID. And how would you gauge that? Of course, you'd look at how many cases, as we're now obsessed with doing, but you'd also look at case fatality rate and the ability to respond to clusters of cases. And Rwanda has done a better job doing this. And that's not a surprise because the United States needs more safety nets of all types. Unemployment insurance is another example. So, I mean, I see this as a possibility for some real and enduring changes in our safety net and our welfare system. I mean, welfare is kind of a dirty word in the United States. Why would that be when so many need it? And I would also just add, if I can just add one more thing, you know, when we talk about cancer and COVID, you know, one of the things that struck me and many other American specialist clinicians is, you know, when we're shutting down our hospitals so that we can pay attention just to COVID, what happens to all those patients with chronic diseases? Nancy mentioned diabetes. We have to think of major mental health problems. But just speaking for a second of cancer, when I was in Rwanda at the height of the American COVID epidemic, you know, I was able to go to the hospital in a fairly rural area and ask, well, what's happening to the cancer patients? And the answer was, well, we're bringing their care to them. So we need a system that is, if we want to go from a sick care system to a wellness system or a health promoting system, it has to reach from hospitals like the Brigham and Women's Hospital into clinics, but also into people's neighborhoods and homes. Community health workers could do that. And unsurprisingly to us, Rwanda has more community health workers, or did not too long ago, than the United States. And I'm not just talking about per capita, potentially in total numbers, this small country versus our very large one. So I think there are lots of lessons, as Lord Darcy said. We should seize on those and work on building out our system. I'm particularly concerned with the United States, of course, as American, building out our system so that it can do a better job, not only preventing these catastrophes, but again, at using the tools we already have to address the kind of pathologies that we can readily see.
Well, Lord Darcy, let's bring you back in on that point. I mean, I think you were saying that some countries have derived perhaps the wrong lessons from this crisis. So as you've talked about moving beyond sick care and health systems, explain what you mean by that. And if you agree with Paul that this is a window of opportunity that can actually spur some real change.
Thank you. And I think both Nancy and Paul made some very powerful points here in terms of, you know, even if you have a national system, and I work in one called the National Health Service, 95% of our resources go to treat the sick. when you have a system so hungry for expenditure on the sick because it's designed as a sickness service, making that change is not that easy. And I think it's a mindset change as well. We wait for patients to become symptomatic, then we see them, we diagnose the disease, and then we start treating them. I mean, let's just think about the last 48 hours over the weekend, the announcement of Biogen on the Alzheimer's drug. There's been 40 of these different novel therapeutics in the last 5 or 6 years, and none of them worked. And the reason this may, because you're treating patients with Alzheimer's at a much earlier stage. So that's the message here. And I think, it's not just harder to treat someone who is symptomatic in the midst of their disease pathway, it's also more expensive to wait. So we need the tools in detecting pre-disease states. And we know most diseases will have a pre-disease state. We need to identify those through novel biomarkers, digital biomarkers, and also create some new interventions to prevent the disease occurring, or even at least postpone its progress. So give people more healthy lives to live before they become ill and presents with their symptoms. And we believe that people are seemingly healthy, but actually are on a trajectory towards disease. And this new area, which I think we need to study, we need to innovate in. And I think that's really where Flagship is coming in and describing this as so-called preemptive medicine. We also know that prevention is better than cure. We should remind ourselves that prevention is cheaper than cure. And that's the only way we're going to get our health systems on a path of financial sustainability. So invest in science, digital innovations, biomedical sciences to preempt major disease. And it's a mindset change, not by the health systems too, but also we need to bring the public, the populations with us. The idea that you're going to visit someone because you are on a trajectory of disease is very different. And I think that's the only way out of it. Otherwise, our health systems will go bust. We're spending 2% above GDP growth in most countries, and it's not sustainable.
So we've got the answers of our poll, and happy to report that we've got a very smart audience. It was almost split between 50 and 70% is the answers. The majority of you got the correct answer. 70% is the answer to the question. According to the WHO, what percentage of global deaths each year are caused by non-communicable diseases? So Paul, I want to go back over to you about the role of inequality, both in the US and globally in this situation. And then I also want to ask you an unrelated follow-up question, but which could segue us into our next segment about vaccines and inequality. I'd love to get your take on the question about patent waivers around the vaccine intellectual property.
Well, I mean, I'll just display my hand early on. I think it was the right thing to do. I've already shared this with Noubar and others who would hear me, and in the popular press, et cetera. But the technology transfer piece is what's really important, right? Because, I've been talking a lot about Rwanda, and I think for good reason. Maybe I should add, Meg, that, I lived there 10 years, 2 of my kids were born there. I've been working there 2 decades and seen this transformation from the absolute wreck that Rwanda was after the genocide against the Tutsi to what I saw last week, which is on the face of it, very flourishing kind of place. But they could also pull off, I believe, based on my previous experience, although different because largely clinical and focused on public health or clinical concerns, I think they could pull this off. And there needs to be some capacity on that continent, which has been, as is obvious to many of you, which has been had resources extracted from it for so long, and has become under colonial rule, really became a clinical desert, quite unlike other parts of the world. So all this to get back to the TRIPS waivers, I was very much for the waiver, and I'm very, very even more passionate about finding ways to work with industry so that we could amp up vaccine production. No, I'm not saying in every country. Why do that? I mean, there's no precedent for that, nor is a need for it, but in some places on that continent. And I'm very grateful too for the openness, because if you look at the map of opposition to the TRIPS waiver, you look at a globe and put little flags on which countries were against it and which were for, it's basically the map of the colonial world, with all of Africa, every country signing on in support of the TRIPS waiver, and almost all European countries against it. So I was heartened, at least by the openness of the Biden administration, and know that the next steps would have to involve serious and sustained effort to make some transfer of technologies that would be required to make, for example, these mRNA vaccines.
That's such an interesting perspective and point. Nancy, we're going to come back to you to sort of wrap up our conversation on this topic. How do you think societies can create more resilience before another pandemic happens?
Yeah, well, that's a big question, and there are many things. So I'm going to narrow it a bit to, creating resilience in the specific space that we're talking about. And again, building on both what Paul and Lord Darzi said, we're treating people when they're sick, they're waiting. I think there's an opportunity to really get ready to improve our two-tiered food system, to really tackle the situation much, much sooner. I always say we've known forever that good food builds bodies and minds, but COVID sort of gave us the burden of knowledge. We know that when you don't have it, it leads to disproportionate death. And, building on even the earlier panel with Lori Garrett, she said, you're going to be hearing health security more. We need to be hearing food and nutrition security more, and we need to be preparing for it. I would love to see in Biden's infrastructure bill, the infrastructure of food. The panel knows many of the things we need to be doing, diversifying away from soy and corn and subsidizing green vegetables that are good for us, but those are more perishable and they require additional food infrastructure. Like, if we really want people to be eating better foods, more diverse and healthier diets, it's a matter of political will. Many European countries have ministers of food. We don't have any cabinet level position on this. I think there's an opportunity to prioritize this. I think if after coming out of the 2020 we've had, with the burden of knowledge that we now have about health disparity and food inequity, if we don't begin to proactively address this in our infrastructure bill, I'm delighted that the United Nations is hosting the Food System Summit coming up in the fall. I'll be attending the pre-summit in July this summer, but that is an opportunity. I think you'll see the world focusing on this a little bit and really saying, how do we leverage food for climate and health and leverage it more effectively as the tool that it is. I think that would be an important area to make a global priority. And certainly we need to make it a priority in the United States.
Such a great point to end this part of our conversation on. Nancy Roman, Lord R. Darzi, and Paul Farmer, thank you all so much for being with us.
Thank you.
All right, we'll turn now to our final theme of the program, science and the tremendous breakthroughs we've seen in record time. What could the vaccines and technologies discovered potentially lead to in the future? Albert Bourla is the CEO of Pfizer. Dame Sally Davies is the Master of Trinity College, Cambridge, and former Chief Medical Officer of England. And Lovisa Afzelius is the origination partner of Flagship Pioneering. Albert, let's start with you. Just looking back on this pandemic behind us and when Pfizer jumped into this vaccine race, help us put into perspective just what has been accomplished here, both from a scientific perspective, but also bringing people and teams together and the manufacturing challenges and just the transformation that Pfizer must have had to go through to get to this point.
Thank you. And I think what was accomplished was likely, if you measure it by the impact, the biggest medical intervention of the century. The fact that was happening the time that we were able to make it, it is only the result of years of preparation, years of scientific advancements, and a culture, I think, that us and others had that needs to be very patient-centric. And I think luck never comes to the unprepared. So clearly, none of the players that were able to deliver solutions didn't do it because of luck. They did it because of deliberate actions that they took.
Well, I want to follow up on that point that Paul Farmer made just in the last panel. I think you probably heard we were talking about these IP waivers. Pfizer has not been in favor of this as a strategy for increasing access to vaccines globally. Tell us why not, and what Pfizer is doing in terms of equitable distribution, and why the system that we have now is the absolute best that we can be doing.
Yeah. The reasons why I don't think this is the right recipe, it is, first of all, because they will not address the issue of availability. These are very high, sophisticated technologies that is not easy to transfer and will take years, even to very experienced people. And the second is because, on the contrary, I think will create issues to our ability to manufacture right now. Right now, we have built one of the most sophisticated, most productive manufacturing machines that is turning raw materials that are highly specialized into vaccines that are saving lives. I believe that by the end of June, we will have manufactured more than 1 billion doses and to have released around more than 900 million of them. I think by the end of the year, we have committed that we will produce 3 billion doses, and next year, 4 billion doses. So these are doses not for the rich, not for the poor. This is not for the East or the West, nor for South. These are doses for all. These are a lot of doses. And the only reason why we wouldn't be able to do more this first half than the second half of the year is because of lack of raw materials. So imagine if right now, around the world, people will start stocking those precious raw materials just in anticipation of that they may be able one day to crack the code and manufacture it themselves. So that will be, I think, devastating. Now, what are we doing to make sure that those billions of doses are equitable distributed are two things. One is we need to make sure that they are offered in a price that everybody can afford. And right now, back in June, we offer this vaccine. Everybody understands the prices in the high income countries, which is the price of a meal approximately. But the middle income countries, they're getting it at half this price. And the low income countries, they're getting all at cost. And the second thing that we want to make sure it is that we are having enough capacity so that they can receive them. And right now we are building dramatically our capacity in a degree that we have already promised that 2 billion doses will be given only from Pfizer's and BioNTech's manufacturing sites to low and middle income countries, and 1 billion of them this year and the other 1 billion next year.
You mentioned the raw materials being a bottleneck. Why can't we make more raw materials? I'm sure I'm not understanding some of the science behind what the raw materials actually are, but why is that still a bottleneck? And why can't we figure out how to increase those too?
I will tell you, this is what we have been able to accomplish is a miracle, but people maybe are getting spoiled, but we are having it now. But just to give you magnitude of the size, we were producing 200 million doses of vaccines until now for everything that Pfizer is doing. And suddenly from 200 million doses, we will go to 3 billion doses. The mRNA technology that we are using never delivered a product. So there was not a network of suppliers of these highly specialized raw materials that had scaled up in industrial production so that they can provide anyone in the world. The machinery that is making the RNA vaccines, the formulation, was designed by our scientists. There was not existing. We designed them, and then we send the blueprints to manufacturers of equipment that they manufacture it very fast for us and delivered it to us. So everything is scaling up. Some of the bottlenecks are common materials like specialized glass, for example. You don't have that much specialized glass, but some of them are highly sophisticated materials that are coming from chemical production, like some very highly specialized lipids. There were 3 manufacturers in the world. We established 9. So we were able to convince people to start manufacturing. We gave them know-how, how to do it. We gave them capital, how to do it, and technical help in the process of scaling up. So this is why we are having the results that we're having right now.
Well, Dame Sally, let's bring you in. And we've been talking so much today about our lack of preparedness as societies, as nations for a pandemic like this. But clearly, as Albert just said, luck never comes to the unprepared. And we did see some preparedness in the science and technology fields. Can you speak to what has gone into putting the medical industry, the scientific industry in a place where we were able to have these kinds of solutions, these vaccines in such record time? Oh, Dame Sally, I believe you're on mute, if you could unmute for us.
Thank you, and good morning. In my past life, when I worked in government, I was responsible for research in the NHS and worked with the British equivalent of the NIH. So let me support what we've just been hearing about the depth of investment from the public sector across the global north and from the private sector in the science that has led to our advances. We could not have moved as fast and had these amazing vaccines, these great new technologies for diagnostics, which are also part of it, without that. What we also need is a trials infrastructure. And in Britain, we have that. I set it up, and we've been able to put over 1 million patients with COVID through trials. So we were able to prove what we expected, that chloroquine and chlorine don't, well, I don't think we did the trial on chlorine, but chloroquine doesn't work. And we were able to show the value of dexamethasone in the right dose at the right moment and of some of the monoclonal antibodies. But that was years of preparation, investment, and practice with other trials to GMP and everything. What we also saw was how our regulators across the world were able to rally and change to a risk-based approach and speed things up. All of that was preparation. We weren't prepared on our supply chains, particularly for PPE and other things. And I want to bring in that while we're responding pretty effectively now to this acute pandemic, of course, there is a chronic pandemic running all the way through and getting bigger and bigger, which is antimicrobial resistance. And we're not prepared for that, either through surveillance, diagnostics, or actually novel treatments. So we need to think about the different types of pandemics, epidemics, breakouts, and what we can do. We also weren't prepared effectively around data and how to use data. 6 months ago, I set up with a number of private sector colleagues and academia, the Trinity Challenge as a collaboration. We put out a public challenge. Could people come in with proposals of innovations of how to use data and data science better for the public health challenges of pandemics, picking them up and preventing them, responding and recovering? And we got 340 applications to the challenge from around 61 countries, 16 great finalists showing that you can collide data science with public health and do things cheaper in a way that will be scalable and help us right across the world. So we need to move on all these different ways. And if you say, why work with the private sector? Of course, governments and health systems have limited data. It's health data. What the private sector have is behavioral data, movement data, expenditure data, other attitude data, which helps us in combating a pandemic or preparing to make sure we never get another.
Such an important point. So we're going to bring in Lovisa now to talk about the global pathogen shield. Tell us what that is and how it could potentially protect us from another crisis of a magnitude like this.
Thank you, Meg. So if we look back like 10 years of time, every year or every second year, there has been outbreaks, viral outbreaks that could easily have turned into a pandemic. And our current pandemic, I mean, it was predictable, it was predicted, and we know that it's only a matter of time until it will actually happen again. So given this almost like exponential dynamic nature of pandemics, we can already now say that more of the same will not help us prepare for future pandemics. Instead, we believe that we really need to think differently to prepare ourselves. And we need to be on an offense. We need to prepare ourselves. We need to preempt threats before they take hold and to constantly be one step ahead. And these were sort of the founding principles from what we call the Global Pathogen Shield. And the Global Pathogen Shield, it includes a number of different initiatives. It's thinking about early warning, it's thinking about instant protection, and it's thinking about immune monitoring, all these kind of things that we believe is needed for a future immune security. So if we think about the underlying technology behind this Global Pathogen Shield, it's actually an artificial intelligence engine that we call Octavia. And with this engine, we can look at a sequence and we can start providing and creating a risk profile as to how it will affect the world. So either that could be a emerging novel variant, but it could also be a future potential variant. And we believe these kind of predictive tools can be very useful in informing, for example, policy decisions, how to act as such. But also this type of information can also help us build or design preemptive medicines. So that's what I call with instant protection, as to how can we maybe build variant-proof vaccines or cross-reactive antibodies that could instantly help us flatten the curve in the coming pandemic. And finally, with this type of artificial intelligence, we can also start working on immune monitoring to understand, are we protected with our current vaccines? Or is it so that we need a boost, and what that boost need to look like? So all in total, I think with this sort of early warning, instant protection, immune monitoring, that is what we call immune security. And that's what we encompass in this Global Pathogen Shield, among other things. And it's really about no longer sort of accepting that we take this defense play. Instead, we need to be on the offense. And we believe that the technology is there to actually make that happen.
Well, Dame Sally, to that point of being on the offense and being prepared, global health ministers convened in the UK in the recent days ahead of the upcoming G7. What were the main conclusions of that meeting?
Well, in the way that health ministers do, they want collaboration and they want to move forward on the science, and they did bring up the clinical trials. On surveillance, and I think what we've just heard from Louisa is very important, and there's proposals for increasing surveillance, but also big support for the idea of a pandemic convention or treaty. Mm-hmm. Underpinning all of this, they want to bring data together and gave great support to the antimicrobial resistance. But I think what's going to be much more important than that meeting is, first of all, the finance ministers met at the same time, and they gave a commitment to work with health ministers and industry, the private sector, on working with this slow pandemic of antimicrobial resistance and looking at incentives to get the pharmaceutical and biotech community back into making new antimicrobials, whether they're antivirals, antibacterials, antifungals. And all of this then goes to the leaders who meet at the end of this week, because they're the ones who our Prime Minister is trying to persuade to agree that we must vaccinate the whole world by the end of next year. They're the ones who will commit the money. And we all hope that G7 leaders will play that leadership role.
Talking about antimicrobial resistance, this was the health scare before this pandemic that was scarier above all else, and hopefully it is a wake-up call to us to see what these bugs can do. Louisa, back over to you before we bring in Albert again. In terms of the scientific progress we have seen over the past year, where do you see room for more breakthroughs? And I wonder also if you've looked at the antimicrobial space, if you see that there is an opportunity for advancements there as well.
Thank you, Meg. Yeah, I mean, first of all, the big breakthrough, I think we will all just want to acknowledge and thank so much, is the mRNA vaccines that have just been developed over this past year and created by Moderna, created by Pfizer BioNTech. And, it's just an amazing new technology, the ability of being able to print new vaccines. I think that's just such a tremendous new platform for us to act upon. And to your point with regards to antimicrobial resistance, that is also absolutely an area that we're looking into, an immensely important area that would also fall under this, what we call global pathogen shield, because this is a very much generalizable concept that we are projecting across all different pathogens per se. But when I think about, these breakthroughs that I'm really hoping for to come out of this, it's I would say primarily a change in mindset, because it's, the idea that we would be able to stop a pandemic before it starts, and the idea that we would be able to really intervene or postpone disease before it even manifests. I think that would be the most important area for innovation for us going forward, because that could really transform the lives of so many people. And if this pandemic, if anything, with all its horrors, with all the, the suffering and the economic loss that we have seen, if it can become the catalyst for change, then I think that those are the kind of breakthroughs that we could leave behind us for the next generation. That would be the most important to me personally.
Well, thank you. And speaking of breakthroughs, Albert, back to mRNA, as you think about the potential for this technology, we know that one near-term application is flu. We know that it originated, BioNTech started working on mRNA as an application in cancer. Where do you see this technology taking us in terms of new solutions in medicine?
I think we need to explore our possibilities, but clearly I see three waves. One, it is what you already mentioned in infectious diseases. Clearly, this technology has been proven that can provide significant effectiveness and safety. So we are looking at multiple viral and non-viral infectious diseases that they do not have a good vaccine right now. Flu is one of them because the flu vaccines are not great, but there are multiple other opportunities that we look at Pfizer, but also others are looking. The second is using your immune system to fight diseases like cancer. And this is something that, again, multiple companies are working. BioNTech is very good at that. And we are also embarking we are very good at cancer. We are embarking now into looking into this mRNA in cancer. And I think the third wave that we will see, it is to address genetically, let's say, transferred diseases, particularly those that they are created because of a mistake in your DNA and the lack of a protein likely that is produced. And with these technologies, I can see a potential application that fixing that. So it's very, very exciting field that we are opening with the mRNA. And we are planning to put a lot of scientists behind this, and I'm sure the world, the biotech community, the other pharmas will do the same.
Well, I want to ask you also about the next steps for the COVID vaccine. We learned this morning that Pfizer started phase 2-3 trials in kids under age 12 for the vaccine. And you're doing this at such lower doses, 10 micrograms for kids, I think between 5 and 11, and 3 micrograms for kids down to age 6 months. So that's 1/10 and 1/3 of the dose for adults and kids over 12. Tell us about this strategy, what you've seen in terms of being able to spur that immune response in kids with such a low dose.
No, always you need to start with low doses when you go with kids, because first of all, their immune system is typically more robust and they are responding very high to it. And also there are kids, we are way more sensitive when it comes to doing the experiments with them. And but we've chosen those doses because we have seen, we have from data a strong belief that they will be safe and they will work. Otherwise, we wouldn't choose them. So, of course, the study needs to confirm that, but we have preliminary data that demonstrated that at those doses, in this age, we should have very good tolerability and very good efficacy.
And a last question for you, just staying ahead of the variants and the need for boosters. What is the science telling you right now as to when folks may need a booster shot?
with everything that I have seen, and you need to see it holistically because we don't have, let's say, efficacy data for everything, but you have immunogenicity data, you have real-world data, you have a lot of data. There is no variant that escapes right now the protection of at least our vaccine that I have seen data. That includes the variant Delta, the one that originated in India and now is spreading to other places, and it is kind of a work. So I think we are good from that front, but the possibility that one variant that will escape the vaccine protection can emerge is there. So I think we need to be prepared for that. And what we have, what preparation means for, in our case, the goal that I gave to our team, which I'm pleased to report that they have made it, it is that within 100 days from the day that we decide that a variant of concern needs a new vaccine, to be able within 100 days to have submitted and be ready for mass production of this variant. We have tested with one variant vaccine against the South African, that I believe it is the beta, the strain beta. We don't need it, right? But we made the vaccine. We don't need it because the current one is effective. Actually, it was 100% effective in South African studies, and it's very high the immunogenicity. But we made it, and we made it within 100 days. So now we have a prototype that will allow us how to work with any other variant we think it is of importance.
All right, Albert Bourla, Sally Davies, and Luisa Abzelius, thank you all so much for being here with us. All right, before we go, let's bring back co-hosts Noubar Afeyan and Ian Bremmer, who've been waiting in the wings, listening to all these fascinating conversations. Let's start with you, Noubar, your biggest takeaway from today.
Well, Meg, it's been fascinating to hear all the different points of view about these topics. And the thing I take away is that really there is a willingness to think in a very different way than we were before the pandemic. I think we're all talking about going back to normalcy. But if normal life means we can't be creative, we can't be bold, we can't defy conventional wisdom, then frankly, I'd like to continue in this abnormal life in the sense that this is where solutions are coming from. And we need to find a way to not accept what we used to before as a given, not accept that doing trials and development and regulation has to be as unclear as we saw last year, a very clear path to working collaboratively to be able to get vaccines developed. We need to think about, not waiting so long to be able to deal with various of our challenges. In fact, we need to think even bigger. We need to ask ourselves, we live assuming that all disease is inevitable. That is an assumption, it turns out. That's not a fact. And so what if we actually set out to make as many diseases evitable as possible? How would we do that? Do we have the technology? Do we have the detection? Do we have the intervention? I think all of these things should not be out of bounds. They should define a new normal, if I can use that expression in this sense, of being bold. And I'll end with one kind of observation. The expression has been said many times, it's not just the years of life, but the life in those years that matters. Well, I think that health security will add years to life and will add life to the years that we can live. And that is an ambition that seemed a bit remote before the pandemic, but I think is quite timely to talk about.
Ian, your final thoughts.
I like this last point from Noubar. If there's anything that living through a year and a half of pandemic in the US should have taught us, is that we have the ability to make and reconsider some fundamental choices about the way we live our lives, how we want to work, how much we want to travel, who our friends are, what our relationships are all about. Well, fundamentally, this is also about the quality of our day-to-day life, something that the Americans have been really bad at over the course of the past decades. Before the pandemic hit, life expectancy in the United States was going down. It's astonishing to think of the most powerful country in the world that could possibly be the case. Mental illness was going up. And of course, obesity, chronic obesity in the United States is one of the highest in the world. And we're doing a really great job in using technology to fight the disease, but we're not yet doing a really great job. In fact, we're doing a very subadequate job in trying to improve the lives of the people that potentially don't have to get the disease. And if they do get the disease, can be much more robust, can respond much more effectively. How much better would US governance had looked if we did exactly the same things, but if the quality of life before the pandemic hit in the United States was closer to what it looks like in a country like Sweden, for example, or Greece? And no, I'm not going to suggest we all eat goat. That was the one thing that came out of the last hour and a half that I'm just not going to stand for. But leaving that aside, Prime Minister Mitsotakis, I apologize for that. Leaving that aside, I think he's absolutely on track. And I do think that everyone that participated today recognizes that this can't just end with fighting the pandemic. That we can get right. But if we lose the lessons for the rest of us for the last year and a half, then, I mean, my God, this will have been the biggest missed opportunity of our collective lifetimes.
All right. I agree with you on the goat, but I will take the goat cheese. Ian Bremmer, Noubar Afeyan, thank you both for those thoughts. And as a programming note, there's one more live stream event tomorrow at 11 a.m. Eastern time. Those conversations will focus on the kinds of global partnerships and commitments it'll take to make all of the ideas we talked about today a reality. Thanks to all of you for watching. I'm Meg Terrell. Have a great day. Stay well.